The most consumed drug in Africa is alcohol. That's right. That means most drug users wouldn't even call themselves drug users because alcohol is a legal drug. And as we know, it's actually more socially acceptable to drink than to smoke marijuana. We'll talk about illegal drugs in a moment, but first, quiz question number 2. What African country has the heaviest drinkers? Well, according to the World Health Organization, it's Seychelles. The average person there drinks a whopping 20 liters of pure alcohol per year. Also in the top 5 is Uganda, followed by Burkina Faso, Tanzania, and Nigeria. Okay, let's talk other drugs now. Did you know that South Africa is the only country in Africa where marijuana is legalized? Well, we asked people in Ghana whether other countries should follow this path as well.
For me, maybe I would go in for weed because it seems that domestically quite a number of people are using this.
So I think maybe weed should be legalized. Pertaining to my idea, weed, smoking it actually is the bad way. But I think something like nicotine, I don't really have a fair idea, but weed in general, when you use it, I think maybe tea or something like that. Like I've heard friends talking about it.
Now, here's an interesting fact. Although most drugs remain illegal, the UN estimates that by 2030, Africa is going to see an increase of a staggering 40% of drug users. Why? Well, the main reason is that the population is growing and getting younger and younger. And statistics show that young people take more drugs. There's one illicit drug that is especially famous among young people: marijuana, aka weed, aka cannabis. Also popular in the population as a whole are heroin, cocaine, crystal meth, and prescription drugs like tramadol and codeine. And then there are local drugs that are often not captured in international statistics.
We also have a plant that grows in Meru. Meru is a county in Kenya that grows a plant called kat or mira. It's also easily available and therefore easily abused.
Other people get their high by sniffing glue or petrol or even smoking lizard parts. What I find interesting is that we Africans have some of the strictest laws against drug use, but that is not deterring people from consumption. Wamala Twaibu from Uganda believes the laws in his country are too strict. His Uganda Harm Reduction Network has been criticized for offering legal support to those arrested for injecting drugs like heroin.
Like if you are arrested with a small portion, let's say heroin or cocaine for personal use, you go in for 15 years. So the law is not fair. And what is happening is that the law enforcement is using the law to extort, get money from these communities, already disadvantaged communities.
I found it shocking that some Ugandans have even been arrested for seeking help. According to the 2016 Ugandan anti-narcotics law, addicts cannot go to rehab or get treatment at the country's only clinic that offers medication-assisted treatment, or MAT, without reporting to the police and a judge ordering them to get therapy. So I'm not surprised that many decide to stay in the shadows. On top of that, African substance abusers are not only seen as criminals, but also as sinners. So instead of getting them medical treatment, families prefer seeking help in church.
So for them, they are believing that if a person is addicted on drugs, should be paraded before the church and be prayed for, and then that demon will run away.
So, what's the best way to deal with the drug issue? First of all, experts say it's important to inform possible users that drugs can have devastating effects on your physical and mental health. Even so-called light drugs like alcohol or marijuana. So please make sure you know about these before taking anything. Experts also believe that it's important to fight stigma, offer free rehabilitation and medical treatment to those who seek it, and treat drug users as people who need medical help and not as criminals. Let us know what you think.